Hey everybody, I'm Dr. Ali Marty, physical therapist and president with Mobile Physical Therapy. To raise awareness for physical therapy this month in October, which is National Physical Therapy Month, I am doing an interview series, and today I have Julie Dendy with Aging with Power. Hi, Julie.
Hi. Yep, I'm Julie Dendy, and I am a physical therapist. I've been a physical therapist for 23 years. Hard to believe it's been that long, but I graduated with a master's degree at Texas Women's University, and it was actually a career change for me. I was in business, have an undergrad in business, and worked for 5 years in business, and then pivoted into healthcare. And I love being a PT. I was a gymnast growing up, and so I've always loved movement, and it's just been such a great fit for me. So it's been a fabulous career.
That's awesome. And so, how long have you been in Vegas and doing the Aging with Power business?
Well, I've been in Vegas for 5 years ago, 5.5, probably about now. Um, I've always been involved in physical therapy. And so when I got here, I started out with physical. For a while, they were very focused on vestibular rehab. And I do have my certification from Emory University to specialize in vestibular. And so I did that for a year, and then moved into a facility called Neurorestorative, which is a residential home for patients with brain injuries. And I worked there for 2 years and set that clinic up and got everything going with the patients there. And we had the residential patients, and then we also had a day treatment program. And then it was during that time that I decided to open up my own business and got started with the Mobile PT Aging with Power.
That's great. So for our viewers who maybe don't know some of those terminology like neurological PT, vestibular, and then mobile PT, can you give a little
Right?
synopsis of each of those?
Sure. So Neuro PT, we focus on kind of any disorder that occurs within the neurological system. So it could be a brain injury, it could be concussion, vestibular system being part of your brain and how you process balance, spinal cord injuries, Parkinson's, strokes. There's quite a few, but it boils down to any injury that occurs to either the central or the peripheral nervous system that results in a movement disorder.
Okay, great. And then you mentioned mobile PT. So some of my patients and clients might be viewing this, so some of them know what it is. But for anybody else who hasn't heard that term before, can you tell them what that means?
Sure. So mobile physical therapy is an area where we come to you with our equipment, with our hands and our tools, and give you the convenience of having the therapy in your home. From a neurologic perspective and the therapy that I provide, it is a really nice way to get people to function in their home. We focus so much on function, and it's one thing to do exercise and train in a clinic, but it's a whole nother thing when the therapist can come to your home and see your incline of your driveway and that threshold that you have and how the door doesn't quite open all the way, and just all the challenges that come with a home and narrow width doors and all of that kind of stuff. So people that have neurologic injuries, movement is really a challenge and function is really a challenge. And so it's really nice to, first of all, not have to travel to the clinic. And then second of all, to have that customized treatment in your home. And I'm always looking for ways for people to exercise beyond when I'm there. So when I'm able to see your home, it helps me structure an exercise program that is easy for you to do when I leave. So figuring out a way to use a counter or to do squats and activities from certain chairs. This chair is too low or it's too crowded in here. Let's use this hallway to practice some walking, that kind of thing. So I know as I've worked in clinics, we issue a home exercise program, and oftentimes it's probably not followed through upon 100%. And so I try to really come up with a program that the client can do in their home and will follow through because it fits. Does that make sense?
Absolutely. And I love what you said about being able to see the different narrow doorways, or how the door doesn't open all the way, or maybe they have a different kind of doorknob, door lever,
Right.
or do they have stairs? Do they have rugs? Is it, a crowded situation? Because I know you've mentioned to me that you help with falls prevention. So
Yeah.
seeing somebody move around in the place that they are all of the time
Right.
would be greatly beneficial. If you can speak to that a little bit more about what falls prevention is and how you can help somebody in the home.
Sure. Well, being able to look, like we've been saying, just looking at there's a kind of a checklist I have in my head, but also a piece of paper where I, go through and give you recommendations on what can make your home safer. Because we know that falls are such a huge problem as people age for various reasons: weakness, balance problems, if there is a neurological injury. There's just all many factors that go into why people fall. But it's it becomes such a debilitating problem when there's an injury that results, and the sequelae that come from that, all the things that happen if you do break your hip and everything else. So I've seen it all. I've seen the slippers. I've seen missing a chair. I've seen tripping on rugs. I've treated all these patients. These things really do happen. So anything that I can do to prevent falls, is really important. And one thing I wanted to mention as well about the mobile PT is that, to clarify, that we're not home health. Home health is more of a complete medical follow-up from post-acute. So if you're coming home from the hospital, if you're coming home from a skilled nursing facility where you need a nurse and a whole team of medical providers, the mobile physical therapy is a different part of Medicare, and you can't be getting those two services at the same time. It's really like you going to the outpatient clinic, except we bring the clinic to you. So there is a distinct difference between home health and outpatient physical therapy provided in the home.
And I think that's great that you make that point, because I talk to people about that all the time, and they say, well, my doctor says I can't have therapy in the home because I can go out and do other things. And home health, the
Right.
definition, you have to be homebound, which is it's a taxing event to go anywhere but a physician's appointment or church.
Right.
And so if you can go out to a restaurant, if you can go visit with friends, if you can go to the park, you're not homebound. Whereas mobile physical therapy in home, it's the convenience factor.
Right.
Like you said, we bring the clinic to you at your house, so then you can get stronger and more mobile in the comfort of your own home.
Right, exactly. Yep.
Absolutely. So you've mentioned a few things about neuro and vestibular, falls prevention. Are there other diagnoses or conditions that you treat or have specialization certifications to treat?
Parkinson's is one, and that is one that is unfortunately growing, and interestingly is coming to be learned. Obviously the research is still coming out, but it is an after effect of COVID. So there are some complications that are very Parkinson's-like that are coming down the road in COVID survivors. So it's just an interesting thing, on top of the fact that Parkinson's is increasing, I think mostly as our baby boomer aging is increasing. And now to hear this news is like, Wow. So I do work with Parkinson's patients. I'm certified in Parkinson's wellness recovery, and it's a very specific exercise program that helps people with Parkinson's continue to move as they move through their disease. And the earlier we can get people exercising from when they're diagnosed to, keep exercising, the more that they can stave off their symptoms and really keep mobile. And as well as cognitively, there's so many things, so much research that's showing us that brain health is positively impacted by exercise. But you do have to get that exercise to a certain level. There has to be, a certain amount of effort that goes into the exercise. And so physical therapists can move into that wellness piece as well if it's not considered medically necessary as Medicare rights. We can still, physical therapists have so many skills to work with you from a wellness perspective to keep your brain strong, to keep you just moving through. We call it wellness because it's past the diagnosis and it's moving into maintaining your movement, your health, your function as you live through life, as you get older or as your disease progresses.
Excellent. And so
also, well, I was just gonna say, I'm also working on a certification called Modern Management of the Older Adult. And so that's really looking at specific upping our dosage of exercise for people, because we've found through research that we're not giving them enough, and we really need to increase that, the resistance, the effort, all of it. So that's been a great course, and I'm going to continue through all 3 phases of that to get that certification.
that's great. Yeah. So for people, it sounds like you're saying for people who want to overall improve their general health, exercise, and well-being, that they can come or they can see you go to them.
Correct.
As a physical therapist, but it doesn't necessarily need to be physician prescribed or medically necessary, and they can still have you come in.
Exactly. Yep.
That's perfect. You really are helping people age with power.
I'm trying.
Everything.
I'm trying. There's another course that I take that I'm halfway through called the Brain Health Trainer. And again, it's really looking at using cognitive demand during exercise. And there's all kinds of ways you can do that with Blaze Pods, and there's a thing called Smart Fit, and just, talking through some verbal exercises while, some verbal problem solving while you're exercising. So much research is coming out that is able to slow cognitive decline, possibly prevent dementia. So that whole brain health piece is really where I like to focus.
That's awesome. And it just sounds so all encompassing. It doesn't just have to be this one thing or that other thing. It's okay, you need help with these different areas. Let's bring them all together.
Yeah, exactly. So yeah.
Excellent. So I know you've mentioned a lot of important points. If there was something that you could say to our viewers again, just to reiterate the importance of it, or something that you wish everybody just understood a little bit more about, if you could bring that to light.
Sure. When I started Aging with Power, it truly was my passion for people to understand that you have the power to improve your well-being, improve your strength, improve your quality of life. You need guidance, and that's where we come in. But there is so much potential to I don't want to say get better, but to continue being active and functional and doing the things you love to do, the things you dream of doing, taking the trips, traveling, all of that stuff. Sometimes you just think, well, today, it is what it is. I've been diagnosed with Parkinson's and it's nothing but downhill from here. Or I've had a stroke and now, there's nothing more I can do. There is always something you can do. And so I just want to empower people and give them the tools to live the best life they can for absolutely as long as they can, from the cognitive standpoint and the physical standpoint. Both are so important.
That's awesome. So if somebody wanted to get in touch with you to have you give them the tools they need to age with power,
Yeah.
where can we find you?
Okay. My phone number is 725-222-0550. And my email is jkdendy, DENDY, at agingwithpower.org. My website is agingwithpower.org. And I'm also on Instagram at agingwithpowerpt.
Excellent. Thank you so much.
Thank you. This was awesome.